So we know that the Andromeda, the seminal study which demonstrated efficacy in Daratumumab, Bortezomib, cyclophosphamide, Dexamethasone in first-line setting patients with systemic AL amyloidosis. We know that patients with stage 3B disease, so the most severe cardiac involvement, were excluded from this trial. And up until recently, we did not have access to this regimen in the UK. We had access to Daratumumab, Bortezomib, Thalidomide, and Dexamethasone. So this IMiD-based quadruplet is not commonly used across the world, and we reported our outcomes. And I think some of the challenges that people have, particularly with immunomodulatory drugs in AL amyloidosis, are the concerns about fluid retention, about potential toxicities with the heart, arrhythmias, and potential thrombosis. So there's a lot of kind of caution about using immunomodulatory drugs, and we know that a large proportion of patients have a rise in NT-proBNP after starting immunomodulatory drugs. So we looked at our cohort of patients and found actually dose attenuation of thalidomide, particularly in this dara-VTd regimen, can actually lead to very good efficacy results and tolerability. So we looked at around 100 patients in the UK, again through the UK National Amyloidosis Centre, and found we got really impressive best hematological responses. So CR rates of around 60%, VGPR rates of about 20%, and clearly there is definite efficacy in this quadruplet regimen. I think we have to be mindful about how we deliver the therapy. So we had suggested that thalidomide isn't given in the first cycle of therapy. We cap the dose, and we think we're just a bit more cautious about how we deliver the therapy, but it is something that can be delivered. And I think that's, again, useful to think about in the armamentarium of treatment options in systemic AL amyloidosis.